Hello, and welcome to our video series on oral hygiene instruction for caregivers of individuals with intellectual and developmental disabilities.
The Smiles United at TCDM
Aims to help caregivers by informing them about preventative practices regarding oral health and by empowering them with techniques to alleviate burdens they experience in providing this care.
People with intellectual and developmental disabilities have an increased risk of dental diseases compared to the average population. Common risk factors that predispose IDD population to dental cavities and gum disease are diet, home care, genetics, and social habits. There are 4 necessary factors that affect oral health and lead to cavities. These are sugar, bacteria, acid, and time. Sugar, for example, doesn't directly cause cavities, but rather provides food for bacteria, which then creates acid. If this acid sits against tooth structure for prolonged periods of time, cavities will develop. Dental decay can appear brown or black and only sometimes can cause symptoms of sensitivity or pain. Plaque is a result of the buildup of bacteria. Dental plaque contains bacteria that cause cavities. Brushing and flossing your teeth helps mechanically remove bacteria and plaque from the surfaces of your teeth. If plaque is not mechanically removed by toothbrushing, the plaque will eventually harden and calculus, also known as tartar, will develop. Calculus cannot be removed with basic home care and therefore must be removed by a trained dental professional. That is why it is recommended to have a routine dental cleaning at least every 6 months. As mentioned before, every time you eat or drink, the bacteria in your mouth produces acid from the digestion of sugars in that food. This acidity is represented by a lowering of pH in the curve shown. During meals, the pH in your mouth is the lowest, and when the pH hits a critical point, the tooth structure is more susceptible to cavities. There are a few things we recommend to prevent decay from occurring during this process. For instance, fluoride toothpaste helps prevent tooth decay by making the tooth enamel stronger and more resistant to an acidic environment. Also, it is ideal to limit snacking and drinking sugary drinks in between meal times to reduce the amount of time your teeth are exposed to this acidic environment. Additionally, having good salivary flow and adequate water consumption is important to keeping the environment in your mouth hydrated. A hydrated environment is less prone to cavities. Many medications can cause dry mouth, which increases one's risk of tooth decay. This is why it is important to consume adequate water or use saliva substitutes regularly to counteract the side effect of dry mouth. The IDD population has a higher prevalence of gingivitis and other periodontal diseases than the general population. Research supports that gum disease is linked to many health conditions, such as heart disease. Therefore, it is important to recognize indicators of gum disease, which may include deep red, inflamed gums that bleed easily upon brushing or flossing. It is imperative that one continues to brush and floss, even if bleeding occurs, to reinforce daily oral hygiene. Over time, the swelling will decrease and the bleeding will subside, which indicates that the gums have returned to a healthy state. If you notice oral changes such as bleeding, swelling, a dry mouth, or suspect dental decay, schedule a dentist appointment for evaluation, treatment, or monitoring. It is recommended that we brush our teeth twice a day, in the morning and at night, and floss at least once a day to keep our teeth and gums healthy. Toothbrushes come in many forms. Bristles can be soft, medium, or hard. We recommend soft bristle toothbrushes to avoid heavy wear to the teeth. Also, different size and shape brush heads can be used for different sized mouths. If the resident brushes their own teeth with your supervision, make sure to observe their ability to hold the brush. Toothbrush handles can be modified as demonstrated here. Toothpaste with fluoride are recommended as long as a patient is capable of rinsing and spitting, or does not otherwise swallow the paste. Non-fluoridated toothpastes are also available for special cases. Consult your resident's dentist if you have concerns about your resident swallowing toothpaste. When brushing your teeth, you should place the toothbrush half on the tooth and half on the gum at about a 45-degree angle. Press gently and use short strokes, moving the toothbrush back and forth, or you can move the toothbrush in a small circular motion. Start with the upper teeth, brushing outside, inside, and on the chewing surfaces. Next, move on to the lower teeth, brushing outside, inside, and on the chewing surfaces. Be sure to brush each tooth. This should take about 2 minutes. Once you are all done brushing your teeth, you can move on to your tongue. It is important to clean your tongue because the tongue can hold on to lots of bacteria, which can lead to bad breath. To clean your tongue, position the toothbrush at the back of the tongue and gently brush forward and backward. Another trick you could use to make holding a toothbrush easier is to modify the toothbrush handle with a tennis ball or rubber band. Place a rubber band around the handle of the toothbrush, around the back of the hand, then back on the toothbrush handle. This way, no grasping is required. When using a tennis ball, poke a small hole in the tennis ball and push your toothbrush handle through the hole. We will now go over different positions to use when cleaning someone else's teeth. Position 1, sitting on the floor. Have the person sit on the floor while you sit immediately behind them. Have the person lean his or her head against your knees. Note that if the individual is not cooperative sitting in this position, you can gently place your legs over his or her arms to keep them still. Position 2, on a bed or a sofa. Have the person lie on a bed or a sofa with his or her head on your lap. Support the person's head and shoulders with your arm. If the individual is not cooperative lying in this position, a second person can gently hold his or her hands and feet as needed. Position 3, lying on the floor. Have the person lie on the floor with his or her head on a pillow. Kneel behind the individual's head, using your arm to help hold the person still if necessary. Remember that it is important to always support the person's head. Take care to avoid choking or gagging if the person's head is tilted back. Position 4, in a wheelchair. Stand behind the wheelchair. Use your arm to brace the individual's head against the wheelchair or against your body. Consider using a pillow so that the person is comfortable. Another helpful tool is a mouth prop. This can be used if it is difficult to keep the mouth open. Place a paper towel on the resident as a bib. To use the mouth prop, place it in the mouth with the ridges facing the cheeks. Then, turn the mouth prop 90 degrees so that the back teeth are resting on the ridges. When using the mouth prop, we recommend working on one side at a time. Complete brushing and flossing on the side opposite the mouth prop. Give the patient a rest before moving to the opposite side. The open wide mouth prop can be cleaned in hot water and used for the same resident until signs of wear are visible. You can use a handle from a toothbrush to retract the cheek. Be sure you can visualize what surfaces you are cleaning. If there is excess food, remove with the tissue or gauze prior to brushing. When brushing the cheek sides of the teeth, have the patient close their teeth to loosen the cheeks for better access. Have the resident rinse with water and spit into the empty cup. If a resident is unable to spit into a cup, use a wet gauze to clean the surfaces of the teeth. Next, when flossing, if using traditional string floss, wrap each side of the floss around your middle fingers. Use your pointer fingers to guide the floss. Floss all touching surfaces of the teeth, as well as the back surface of the last teeth in the mouth that are not contacting another tooth. When using a floss pick, be careful not to force the floss down, as you could damage the gums. Instead, use a gentle sawing motion until you get the floss past the contact. Then, gently scrape up and down against each tooth, then pull up to release the floss.
There are many reasons why providing oral hygiene for someone else can be difficult. Anxiety, resistance, low motivation for dental health, and difficulty listening to instructions are a few of them. We hope to provide you with a few techniques to make the process of taking care of someone's teeth an easier and more comfortable experience for everyone involved.
Tell, show, do. Tell. Use age-appropriate language and allow the individual to ask questions. You can make it fun by explaining that they are brushing and flossing to help get rid of sugar bugs. Show. Show the person on their fingers what you are about to do to their teeth. For instance, you can have them hold up multiple fingers and rub the toothbrush on the sides and use the floss to go between the fingers. Finally, if practical, you could have the individual watch you when you brush and floss your own teeth. Do. Keep a regular routine so they know it's expected. Positive reinforcement rewards desired behaviors, thereby strengthening recurrence of those behaviors. Some examples include facial expression, verbal praise, and appropriate physical affection. Use descriptive praise that emphasizes specific cooperative behaviors such as, "Thank you for sitting still," and "You are doing a great job keeping your hands in your lap," rather than generalized praise such as, "Good job." Other reinforcers include tokens and toys. Normally, when we think of counting as a behavior guidance tool, we think of people counting down during bad behavior that, if not stopped, will result in a consequence. However, we do not want oral hygiene to be associated with punishment. We suggest starting a slow countdown from 10 at the beginning of brushing and flossing. Distraction is a technique of diverting an individual's attention from what they think is unpleasant. Distraction may be achieved by imagination, such as telling stories, and audio, such as music or visuals like television and movies. Similarly, giving the person a short break during a stressful procedure can be an effective use of distraction. Allow breaks during brushing if the person becomes anxious or upset. Remember, it is important to end every mouth care session positively. This means that you should stop brushing or flossing just before any negative behavior occurs.
We would like to thank those who helped fund this project, such as the New York State Developmental Disabilities Planning Council and Touro College of Dental Medicine. But most importantly, we would like to thank you for being passionate about learning more about oral hygiene practices for your residents.